Hi, my name is Carlos. Welcome to my Mental Health Talk vlog. Hello. So, I've decided to embrace the new digital world and economy and started my own vlog talking about something I'm very passionate about, which is mental health. Why am I passionate about it? Well, I find the subject fascinating. Psychiatry, neuroscience, psychology, anything to do with the brain, anything and everything to do with the brain just completely blew my mind. But I'm also a mental health patient. I'm now 40 years old, and the last 5 to 6 years haven't been easy at all. So what do I have? Well, forget labels. I can talk about them, but I think the DSM-5, the ICD-10, whatever, they're just ways to make it easier for the medical profession to do things, because medical science is still very limited, mainly when it comes to psychiatry and when it comes to mental health. So it's easier for them to have a lot of criteria, a lot of symptoms, and put you in the box or in this drawer and say, okay, you have these, so now we know which protocol to follow. But many times the protocol doesn't work. It happens quite often in psychiatric medicine that things just don't go according to plan. Actually, any kind of medicine, but psychiatry more so than others. The personality traits that can be deemed somehow pathological have been with me since I was 15, 16 or 17 years old. So one of the possible diagnoses I have, it's a borderline personality disorder traits. I hate that term. Emotionally unstable personality disorder for me is even worse than borderline personality disorder. I would call it complex personality. I don't know, complex personality disorder, something like that. So yeah, in hindsight, looking back, most of my traits have been there, but I was in the music business. I grew up as a musician, very impulsive. I was always very artistic, very impulsive, very wearing my heart on the sleeve. And until I was 30, my personality traits didn't really bother me much, because people are used to eccentric personalities in the music business. Then when I was 30, I became a father when I was 28. When I was 30, I decided to change my life. So I started studying science. I went to university, and things started getting worse. And not because of the environment, but because academic pressure really takes its toll on me. And there was a lot of alcohol involved as well. And I think alcohol is a very dangerous and potent depressive drug. So I don't advise anyone who has mental health problems to consume alcohol. For me, it was the worst thing I've ever done. All my anxiety trebled. My depressive episode was brought upon by alcohol consumption. And yeah, when I was 35, so 5 years after I started my life-changing moment, I was diagnosed with a major depressive episode. Then there was some ideas that I had bipolar disorder, which I don't. Maybe I have cyclothymia, which is a mild form of bipolar 2. So we get the highs and we get the lows, but not very suicidal depressive lows, and not hypomanic, or definitely not mania, but not hypomanic episodes. Just I had phases that can be considered hypomanic, but I've never had mania in my life, and definitely never had psychotic breakdowns. But anyway, enough about me. I'm a mental health patient. I'm passionate about mental health. I've studied a lot about psychopharmacology, about pathology, about mental health issues, and I've decided to start this vlog to help others and maybe give them a different idea of what things are. And the main idea is to trust yourself, trust your gut, and learn as much as possible about your condition and learn to live with it. It's called insight. It's very important when you have mental health issue of any kind to have insight. For example, today it's a very grey, rainy day where I am, and I felt it. After 2 days of grey and rainy. It's funny because I lived in England for 15 years, so the grey and the rain shouldn't affect me, but they do. They call it seasonal affective disorder. It has to do with serotonin levels in your brain, but it really, really affects me. But now I know. Now I know why I'm grumpy. Now I know why I'm upset. Now I know why my energy levels are low. It's because the weather changed. Maybe I have less serotonin being produced, although I'm medicated. And it changes my mood a lot. I really feel it. But having the insight and having the knowledge really helps me because it makes me think, oh, today's going to be a bad day. Okay, grey, rainy. There's a bit of psychological trickery going on as well. But it's physiological as well. I feel it. I wake up and I feel like, oh, wait a second, my thoughts are foggy, and I open the window and I go like, oh, it's a bit depressing. But learn as much as possible about mental health conditions, about your condition. Search for alternative ways to deal with it. Believe in psychology, believe in psychotherapy because it's very important. And we're here next week to talk about something else. I don't know what yet. I'll probably start by talking about depression, my take on depression, and ideas to cope with it a bit better, other than just taking your SSRIs, which are very important, of course. And yes, keep well and have the best mental health possible. And remember, one day at a time. That's all we have. Thank you. Bye.